What is one myth about plastic surgery that you wish more people would need to let go of?
I think the misconceptions that the people who do plastic surgery are vain or are succumbing to societal pressure. Plastic surgery isn't about that. It is for people to be empowered to embrace their own beauty, not the beauty defined by the world. You know, it can be so life-changing, even something like bad ears, like prominent ears, or for like guys who have gynecomastia, man boobs. They end up being teased from childhood, perhaps. It's not that you're trying to change them into someone else, you know. You just want to help them become what they are. These are plastic surgery, but it's not because they're vain. We are trying to give them back what they lost.
People don't realize that after pregnancy and having kids that, you know, it does a lot to your body.
Social media portrays all these super moms that snap back into shape. And that is not true. There's the hair loss, there's the pigmentation, the loose skin. It never goes away even if you lose the weight. Sometimes the vulvovaginal area is affected. Sexual function is affected. Plastic surgery is just one of the tools to kind of help you along the way.
Does it matter for you as a plastic surgeon why someone comes and walks into your office?
Yes, it does. I always tell them it has to be for yourself. It cannot be for anyone else to salvage a marriage or broken relationship, because at the end of it, you will not be happy.
I'm Nicole Lee, and welcome to You Never Know, where we talk about life, career, finance, and health with visionary people who have taken the unconventional road and embraced the unknowns. If this episode resonates with you, I'd love for you to like, subscribe, and share it with someone who might need it today. Are you ready? Let's go. What's the first thing that comes to mind when you hear the words plastic surgery? Vain? Fake? Superficial? I know, that's what I thought too. But what if plastic surgery is more than just changing the way you look, but more about coming back to who you are? Today's guest is a plastic surgeon, a mother of 5, and someone who believes that plastic surgery is not vanity, but about empowerment and restoration. She spent nearly 2 decades at Tan Tock Seng Hospital in Singapore, one of the region's leading trauma centers, where she led breast reconstruction and is also the program director of the National Healthcare Group's residency program. Now, she's starting her own private practice called the Plastic Aesthetics Practice at TDP, and today we're going to talk about everything from mummy makeovers to Botox and breast lifts, and also her journey as a working mom and a female surgeon. It is my absolute pleasure to welcome Dr. Michelle Ho to You Never Know. Welcome to the show, Michelle.
Thanks so much, Nicole. Thanks for having me here, and so nice to catch up with you again.
Oh, it was so good to see you the last time. I remember when we met and I found out that you were a surgeon and then you're a mother of 5. I remember meeting you with your husband. I'm like, what? How do you do that? Because I only have 1 kid and I find it very challenging already. So Michelle, my first question is, how do you do it? How do you be a surgeon and a mother of 5?
I think it's a question that like a lot of people ask me. They just usually drop when they find out I have 5 kids. But definitely this is not done alone. I really believe in what people say, that it really takes a village. I've been very blessed to have a very supportive husband who's very hands-on, very involved grandparents who help with the kids, and of course the resources to engage help in childcare. But other than that, I think a lot of it was also about managing my own expectations, that I cannot be a perfect mom, cannot be a completely present mom, but knowing that there are all these people that love them and can provide for them. And truth be told, my kids say they prefer that, space as well.
Oh, wow. That's good to know. Yeah, I mean, I completely resonate with not having to be a perfect mom, because I think I went through a lot of that as well, especially when you grow up in a society that values a lot of excellence and perfection, right? When you said that your kids feel that they have much more space with you working, what did that mean?
I think the fact that I have 5 kids and I'm working, I can't helicopter parent, and I can't control or send them for like 1,000,001 classes. But I think they appreciate that space, which allows them to grow and develop on their own and exert themselves in their own way, which I think is very important for them growing up. I guess I've been forced to let go early and let them grow.
What do you think are the biggest lessons that your 5 kids have taught you?
I think they have taught me so much in life. I think really, I think the theme of letting go in all aspects of my life. As a mom, truly to let them have their own space to grow, to fall and pick themselves up. As a surgeon, that I cannot control everything, and sometimes I have to just go with the flow, even though I may have plan A, B, C, D, but a lot of times if plan E and F comes up, have the faith that I have what it takes to carry it through.
For me as well, one thing that I picked up about what you said earlier was having a very supportive husband. I know he's a doctor as well. He's a cardiologist. Do you think having a partner or a husband in the same field actually helps?
I think for me especially, it did help because he could understand why I was putting in such long hours into my work, staying back, or even after work preparing presentations. In the training years, studying, writing papers. I think that really helped him to see, and I didn't have to explain to him why I was still doing all this even after I came home. So I think for me that helps. Although I've also seen many couples, a lot of my friends who are married, non-medical people, and I think it also helps them in some ways because they might have more time also to take on more burden in the family. So I always say there's like pros and cons to every situation. But I think the benefit for me is that my husband understood why I needed to put in those hours. And perhaps my absences and the times that he had to pick up more. So we kind of work as a tag team. When it's busy for him, I try and pick up more slack in the family, and then, vice versa.
Really great to hear. And I think it's very important to have a partner and spouse that's really supportive of, especially a high performing woman as well. So plastic surgery, you don't see many plastic surgeons around in Singapore, especially not female plastic surgeons. Why do you decide to choose plastic surgery?
Well, I chose it because I really like the feel. Initially, I didn't know what I wanted to do. I was doing another posting where a senior told me that perhaps you should try, plastic surgery just to learn the skill sets of tissue handling and be exposed to it. So I went in hoping to just pick up some skill sets. I knew I was surgical, but what aspect I wasn't sure. But when I went in and I really fell in love with the work that involved, I love that it is both an art and a science. And that no two patients are the same. Even if it's the same surgery, it is really tailored to each and every patient. And I really love that aspect. And I also love the fact that it really gave patients back dignity and hope in terms of the reconstructive work. But even aesthetic surgery is an extension of reconstructive surgery because it's giving back people what they lost. And I find that helps them to live a quality of life that is very important to me. So it's something that I felt that I wanted to do.
Yeah, I never thought about plastic surgery that way, giving people what they lost. And earlier you mentioned that it's an art and a science. I don't think people think of it that way too. Why do you think it's an art?
It's an art because a lot of it has to do with perception of beauty. And if you realize, actually, perception of beauty also varies across the globe. A beautiful double eyelid in one area may not be deemed beautiful in somewhere else. Like some places might want a more large-breasted, more obvious kind of look, whereas in some other countries you want a more natural look. So that, beauty and aesthetic sense varies. That's one. But then there's also the science of it all, the technologies that we have, the techniques, the types of implants and equipment that we have. So it's both art and science, and it's marrying the two together to achieve something beautiful. Because it's not just, doing a surgery to take out a tumor and everything, but I like to liken it to sculpting.
Okay.
Yeah. So, it's like slowly shaping it into a form that is beautiful. It may not be beautiful to everyone, but, to the person himself who can appreciate that beauty, I think that's important.
I love that. I think it's very personal, right? In terms of how one views beauty and how one wants to show up in the world. And I think that is really the beauty of plastic surgery. I'm starting to see, what lies underneath. How hard is it to be a plastic surgeon in Singapore?
Okay, I think like you mentioned earlier, there are very few plastic surgeons. It's because there is a cap on the number of people we train to be a plastic surgeon each year. So I guess that's one limitation. But I guess in terms of the training, it's also one of the more rigorous programs. because it's quite a long training program. In my time, it was 2+4 with a waiting period, and there was always a queue for people to get in.
2+4 meaning?
2 years of basic specialist training and then 4 years of advanced specialist training.
Okay.
But now we are a 6-year residency program. So so it's just that it's a very rigorous program that requires a lot of studying, because we cover everything from inside out, from young to old, from micro to macro. So the scope of plastic surgery is very wide. Our surgeries can be very long. And our residents also have to do a lot of research and writings of papers.
Right.
So it's not an easy program, but I always tell them, no, if it's something you love and you know what you're getting yourself into, you won't regret it.
So how many people are there in one cohort?
I think in my time, it was like they took 2 or 3 a year.
Oh, wow.
In the past, it was like 1 or 2 a year. But currently, it's a lot more. Now we're taking 6 to 8 a year.
Okay, but still very small.
Yeah.
Okay. And you talk about the length of your surgeries. What's the longest surgery that you've ever been in?
Oh, wow. I think it lasted from 8 a.m. to perhaps the next day, 3 p.m.
Oh, wow.
Yeah, but of course we took breaks, and some parts we were not involved.
Yes.
But I mean, because some parts are with the resecting surgeon, on that, of course we don't operate like throughout. It's just that that's the time that we were in the hospital.
Wow. Okay. Let's talk about stigma. Because when people think of plastic surgery, especially in Asia, they think of it as very superficial, and people still think that it's something that you don't talk much about, right? That's why you don't really hear that much about it in Asia. So people think it's superficial. They think it's for women mainly, and they think that women who do plastic surgery are more superficial and insecure. What do you have to say about that?
Well, it's a very common thing, but one thing I'm glad is that it's becoming less and less of a stigma, especially with the younger generation.
Okay.
I think with increasing awareness of plastic surgery, but there is still a stigma, I have to agree. And so patients are sometimes a bit shy to come and see us. Actually, I think this stigma is really something that has to be corrected, because plastic surgery is not that. Plastic surgery is, like I mentioned, is about empowering people, whether it's the reconstructive part, where after removal of the tumor, removal of the breast, we give them back a breast or reconstruct their face, to give them, life as it is, or whether it is aesthetic. We are not trying to transform someone into someone they aren't. We are trying to give them back what they lost, whether it's from the drooping of the eyelids with age, or whether it is for moms who have undergone pregnancy, childbearing, breastfeeding, and lost their figures, or even dads who develop dad bods, because of self-neglect, because, they're taking care of the kids, finishing up the leftovers. We're trying to give them back what they lost. We're not trying to make them a different person. And it's just important to give them that choice and that option to do so without being judged, because I think it is actually a very empowering process. And it's important to look good and feel good. Yeah.
Does it matter for you as a plastic surgeon why someone comes and walks into your office?
Yes, it does.
Okay.
So
Tell
I
me
always
more.
like to tell my patients, I always ask them motivations for plastic surgery. And I always tell them it has to be for yourself. It cannot be for anyone else, to please anyone else, to salvage marriage or broken relationship. Because at the end of it, you will not be happy, and you will not be happy with the outcome no matter what, because those are things you cannot control. But if you're doing it for yourself so that you can feel better, more confident, then it's completely different. It becomes an empowering process, something that is meaningful. And then, that should be the reason why you do plastic surgery.
Right, you do it for yourself 100%, because otherwise they will never ever be satisfied.
Yes.
And they'll keep coming back
Yeah.
for more. It's like almost an addiction.
Yes. So there's like body dysmorphic disorders, or, patients who might be depressed and stuff. I think the right thing to do is really to guide them, and help them get back, like I mentioned, their lives, not to help them down the spiral.
Yeah. So I'm just curious, for patients who come in with body dysmorphic disorders or depression, do you actually turn them away if you find that their intentions and the reasons why they come for plastic surgery is something that's not aligned to what you value?
Yes, I do. So I would actually gently, of course, it comes with building a relationship with them. I think we're in a very privileged position where patients are actually kind of expose their most vulnerable sides to us. And I really appreciate that. And that's why I think this doctor-patient relationship and trust is very important. And once that part is built and the patient knows we're acting in their interest, then we try and broach the topic to them about perhaps you might want to put this on hold first.
Yeah.
And then maybe you might want to seek psychiatric help or counseling. I'll direct them to the relevant avenues and then tell them they can come back and do this. It's not something that's urgent. Plastic surgery is not urgent, but you can always do it anytime. But, the most important thing is to take care of themselves and their well-being, their mental health first before coming and doing plastic surgery. Because plastic surgery does not solve all problems.
Yeah. No, I love that because you mentioned how people are very vulnerable when they come to you. So you don't just have to be a doctor, you almost have to be a a friend. Oh, yeah, you have to be a friend.
Right.
Yeah, I think that's what differentiates as well. Good doctors or good whatever it is, right? From others as well. I want to touch on two things you talked about earlier, which is mummies and dads.
Yes.
But let's dive into mummy makeovers because it's something that I know you feel very strongly about, and we're both moms.
Yes.
So I think people don't realize that after pregnancy and having kids that, it does a lot to your body, and for some people to their self-esteem as well. You don't really see what a woman feels after she gives birth, even though she seems so strong and fit and that kind of thing, right? So tell me, what are mummy makeovers?
Okay, so the traditional definition of a mummy makeover comprises a breast and abdominal procedure. So it might be a breast augmentation, a breast lift, or a combination of that, and either liposuction or tummy tuck. So, kind of restore the breast and the tummy. But like you said, after being a mom and going through pregnancy, I realized there's just so much more that changes, right?
Yeah.
There's the hair loss, there's the pigmentation, the loose skin. It never goes away even if you lose the weight. Some stretch marks, just so many things. And sometimes even, the vulvovaginal area is affected. Sexual function is affected. Just so many things. And honestly, I don't call it a mummy makeover. I think what we need is a postpartum glow up.
Yeah.
Because, women just go through so much. And I think that before I had kids, I didn't realize that because social media portrays all these super moms that snap back into shape.
Yes.
And that is not true. We have to give ourselves time to heal and recover. And plastic surgery is just one of the tools, subsequently to kind of help you along the way.
Yeah, I mean, I have so many things to say about that as well because, like you, before I had kids, I had no idea what it meant and what it did to my body. And to be honest, a lot of, not all men and women understand about what it does to you, psychologically and physically and emotionally as well. So you talked about a couple of things, liposuction, breast lifts. And there's so many more like hair loss and all this part of plastic surgery?
Yes.
Okay.
Yeah, that's why I said plastic surgery covers a lot of fields from the non-invasive, minimally invasive to the surgical aspects. So I think it's very important because a lot of things are not talked about.
Yeah.
But I feel that people need to know that there are options for all these problems. You don't have to suffer and struggle with all these things alone in silence. There's actually things that can be done to help you, become who you were before. It's not just the moms, like you said, right? The dads,
correct.
too. Yeah.
What are the few most common procedures that people come to you post childbirth?
I would say the classical mummy makeovers, tummy tuck, breast augmentation, liposuction, stuff like that.
Okay.
But also, subsequently along the way, the pigmentation, the dryness of the skin, the loss of that glow because, they just lack the sleep and the rest.
Let's talk about breast augmentation then. Like what kind of conversations do you have with your patients to help them make a better decision on even like how big or I don't know because we don't talk about it, right?
But that's why I also always emphasize that it's important that the doctor and the patient share the same aesthetic sense. It's just like, your hairdresser, your brow artist, you always go to someone that you can share the same aesthetic sense. So that's one.
Interesting.
And secondly, so that conversation, will go on with the patients, and they usually will tell us what they would like to look like. But of course, we would tell them perhaps what suits them, and advise them according to their height, weight, and their build. We also have various technologies like 3D scanners that can simulate what the various implants would look like in them.
Right.
And then we can discuss with the patients what suits them. It's a two-way conversation. It's not like the patient says they want this, and then I say, okay, but rather it's two-way. I have to tell them what are our limitations that we might face, based on their own physique, how much skin they have, and how tall they are. So stuff like that. It's a two-way conversation.
Interesting. When you said same aesthetic sense, I had no idea that you also had to choose a doctor based on the aesthetic
I think it's
sense.
important to share that common aesthetic sense. So for myself, I prefer a natural kind of look.
Okay.
But if a patient wants a very overly done look, and it's not something that I feel would look nice with them, then I would be very honest with them. But at the end of the day, the patient has to decide, right? What is good for them. It's just like when you go to a hairstylist, you go with someone who shares the aesthetic sense because they can deliver
Interesting.
that same thing. And to me, that is my art, right? It's got my name on it.
Right. So interesting because you also want your portfolio of clients in terms of the output and how they look to also represent who you are and the kind of work that you stand for.
So for me, it's like safety is so important. I wouldn't want to choose something too big that might result in complications, and stuff like that. So safety and natural aesthetic are so important to me.
I see.
And it's something that I probably would not want to compromise on.
Oh, I had no idea that having bigger boobs is actually is it more dangerous?
No, I think if it's abnormally large, like those some of those Hollywood stars from the past,
Yes.
when it was exaggerated.
Yes.
So if a patient were to come to me for an exaggerated look, that results in potentially more complications down the road. And so to me, that is not safe and that's not ideal for them. And then I would advise them. And of course, at the end of the day, it's up to the patient whether they agree or they disagree and whether they continue this journey with me.
Okay. Let's talk about another thing that's quite taboo, vulva rejuvenation.
Yes.
Not many people talk about it. Tell us a bit about why vulva rejuvenation is important and how it helps women, especially after childbirth, but also for women in general.
Yeah, I think this is something that, like you said, is not talked about.
Yeah.
But a lot of women are actually suffering in silence, and like after childbirth, they might experience some pain, and after menopause, especially, there's dryness and perhaps discomfort, and actually there are a lot of other symptoms, urinary incontinence, after childbirth and menopause. So these are real issues, and I've had friends and patients tell me that they don't dare to jump on the trampoline with their kids because they're scared that they would be incontinent, and I've had at least 5 people tell me about this trampoline jumping thing. So it's really a lot more common than you think.
Yes.
So I think there are a lot of women who are suffering in silence. It's not an aesthetic, purely aesthetic thing, although we can enhance the aesthetics at the same time, but there is a functional component to it, and it affects the quality of life. If you have to keep waking up to pass urine, or you can't jump on the trampoline with your kids, it does affect. If it affects the intimacy between husband and wife, so I guess that's why it's not talked about. People are quite reserved in this part. They're shy. Yeah, but if we don't talk about it, you won't realize that there are options, and these patients, after they've undergone treatment, they're really, really very happy because their life, their confidence, quality of life, their lifestyle is completely changed.
Yeah. And not all of these procedures has to be surgical, right?
No.
Right?
Yeah, so they're non-invasive options as well.
Let's talk about plastic surgery as an operation because, a lot of Asians, we feel like going under the knife is very life-threatening, it's very unnecessary. Help us to debunk the myth about plastic surgery being dangerous.
If plastic surgery were dangerous, then I'll be out of a job.
Yeah.
I guess that's where the role of the surgeon comes in.
Yeah.
It's really to discuss with the patients, the various options, what's safe and what's not. And it's not safe to proceed, to tell the patient, that perhaps this is not safe, and, to curate and see what is most suitable. Basically, it's really to journey with this patient down the road and to optimize, the conditions to make it as safe as possible. But the truth is that, well, there's nothing in life that's without risk, right? Even if we were to walk down the street, take a plane, everything has risks. But I think it's all about risk management, and that's where the surgeon comes in.
Right. Tell us more a bit about risk management, meaning give us one example of how you manage risks in like operations.
Okay. So in terms of managing of risk, firstly, we also need to make sure that the patient has a good physical condition, make sure they're healthy. If they have a lot of other medical problems, then it might not be safe, or we might have to do certain things to optimize them and make sure they're fully checked before that. We also cover with antibiotics to prevent infection. Complicated surgeries would be done in the major operating theaters, but even things like whether it's a day procedure or they should stay a night or two, or choosing the option of surgery that is safest for them. So there's just so many aspects, or even the aftercare, taking care of them during the recovery process. So it's really about journeying with them and minimizing this risk.
Okay. Let's talk about some non-invasive procedures and some of the more common ones aesthetically, which are, I think, Botox and fillers. A lot of Asians, men and women, like to look younger than their age. Tell us more about Botox versus fillers, and how do people decide?
Okay, so Botox is just a brand name, but it's actually a botulinum toxin, which is a neurotoxin. Basically, it impedes the transmission of neurotransmitters. So basically, it paralyzes muscles. So it is for overactive muscles, that result in wrinkling. So whether it's crow's feet, forehead lines, or like furrows in the what we call glabellar creases, these or even like overactive masseter. So this is what Botox does. It paralyzes this muscle.
Okay.
As for fillers, it deals with the other aspect of aging, which is when things deflate and lose volume and sink. And so fillers are meant to fill and to lift, as they are called. So they serve two different functions and can be used together.
Right. Okay. So my question is, there's so many aesthetic clinics around. Why would someone choose to go to a plastic surgeon for these kind of aesthetic treatments versus, say, going to an aesthetic clinic, which might be cheaper?
This is coincidentally a question a patient just asked me
Really?
yesterday. Yes, I had practice. So basically, I tell them that yes, definitely there are a lot of options on the market, and again, in Singapore, everyone's very well trained. But I guess the unique aspect of a plastic surgeon is that we are able to offer the full spectrum of from non-invasive to surgical, and with minimally invasive in between. And this allows us to be able to counsel the patient on what is most suitable, because sometimes beyond a certain point, surgery might deliver a better result, than just filling and filling. And there's this overfilled syndrome where patients look too filled or frozen faces. So I think beyond a certain point, sometimes surgery or something slightly more invasive might give the results that they want. And so I guess the advantage of that is that we are able to give them that whole spectrum. And having operated in these areas, we're also very familiar with the anatomy and minimizing the risk, avoiding danger zones and stuff like that.
So basically, through the process, at certain points in time, you'll be able to advise the client, for example, that, hey, maybe, after this amount of Botox or whatever fillers already, that maybe another procedure might be more long-term and sustainable.
I guess it's also managing what their expectations are. Like if you want to achieve a certain result, then you might need something more invasive. But if you really don't want something more invasive, then what is it that the non-invasives can do for you up to a certain point? So I think it's that discussion that we are able to give our patients.
Yeah, you mentioned quite a few times up to a certain point, because I've also learned from you and from someone else as well that Botox is actually a toxin. So is there up to a certain point, is there like a maximum amount of Botox you can actually, put into your body before it actually really becomes dangerous?
I think most times what we put into the body is quite limited.
Okay.
So I don't think over toxicity is an issue. But I think what happens is that beyond the wrinkles, what happens with further aging is you develop skin excesses that cause that wrinkles that is no longer due to muscle hyperactivity, but the excess skin or, deflation that has resulted in that result, that appearance.
Right. So it's something else.
It's something else
already.
Yeah, beyond Botox. Yeah.
Right. Okay. So let's talk about how many people in Asia and Singapore, they are often going overseas for procedures. Places like Korea, Thailand, because they claim it's cheaper and better. So Dr. Michelle Ho, is it true? Is it true that, surgeons or plastic surgery in Korea and Thailand are cheaper and better?
I think it's potentially cheaper. I think I cannot deny that. But of course, there's a whole spectrum, right? Whether it's overseas or locally, there's a spectrum of pricing. So, but price otherwise, you're talking about in terms whether they're better. I think that's the part that I really want to address. And of course, in some places, their volumes are very high. And in every country, there's some masters in their trade. And that's why, we also go to these people to learn from around the world. But, does volume really make you better? We come back to the sculptor and the artist. Do you do 10,000 of one sculpture or the same painting again in order to, perfect your art? Not so, right? You achieve, they train themselves in the various skill sets, the technical skills, their abilities, their aesthetics, and basically use those skill sets to deliver that result. I think especially so in plastic surgery, right?
Yeah.
Because like I said, every single patient is different.
Yeah.
So I would say that, most important thing is that the surgeon is equipped with the right skill sets to deliver the results and discuss, and journey with that patient to achieve that.
So what you're trying to say is that it does not mean that if someone practiced on the same kind of art for like thousands of times means that that person is necessarily better.
I think, of course, there's some benefit, from muscle memory and everything like that. But I don't think that is the only aspect you should look at. I think the other aspect of going overseas is that I think there are a lot of patients who do it on impulse. I've had patients who come and say that, they accompanied their friend and then they decided to just jump in and do it as well. Or maybe they wanted to do one procedure, but they were convinced to do multiple. And under the pressure of time, with no cooling off period, because they want to finish everything during that trip, they make certain decisions that they subsequently regret, whether because that was not what they want or whether there were some complications. But I think that's the thing about doing it overseas on an impulse. So I think it's okay to go overseas and do it. But you need to have done your relevant research. Make sure you've gone to someone credible and always ask, like in terms of implants or injectables, what is being put inside you. So I think making an informed choice is very important. So I think going overseas versus locally, the advantage of doing it locally versus overseas is that you have that time to slowly make that decision. I always tell my patient, don't tell me today. Go back, think about it, because it's quite a life-changing thing. Go back and think about it, whether you really want it. And then after that, you can do the relevant research, right? And come back and ask me all your questions before you decide whether you really want to go ahead with it. So I think that's the advantage. And I guess in terms of the control and the governance here, I guess in some places you may not even have to be a plastic surgeon to do all these procedures, which is why I say it's important to do your research if you want to go overseas to do it. And I guess the other thing is that should something go wrong and you need to fix it, and then you have to fly overseas to fix it again. Or even if you do it here, then there's also additional costs involved. So I think that's there are pros and cons. I wouldn't say it's wrong to go overseas. I would say it's important to do your homework.
So basically what I'm hearing is that it may be cheaper, but also the range of quality, the range of outcomes in terms of what different doctors can give is also wider overseas versus in Singapore, and also the materials that they use as well to make sure that it's legit in terms of what they use. What would you say to someone who is thinking about having plastic surgery? What are some of the factors they need to consider before they, let's say, walk into the doctor's office?
So I always ask my patients why they want to do it, I think their motivations, and what they hope to achieve, because I think it's important to have realistic expectations. Advise patients that they should then seek medical consult, because if you do your research on your own on the World Wide Web or Google, this is just so broad and so confusing, and it may not be what is suitable for you. So perhaps go for a first consultation, find out more, hear what they have to say, then go back and do more directed research, and then go back to that doctor with your questions, or even get a second opinion, no issues with that. Then before, so it should be thought out process, with the right motivations and realistic expectations.
Yes. We don't talk much about plastic surgery in Singapore, in Asia. What is one thing that you wish more men and women knew about plastic surgery?
Well, that plastic surgery is not just vanity. It's really about empowerment, and it's not something to be ashamed of. It should be embraced. Plastic surgery is meant to help you improve your quality of life.
I love that. Just like how exercise or meditation is meant to.
And so it's a very holistic thing, I believe, like that patients should be exercising and everything. It's like liposuction is actually not a weight loss mechanism. It's a sculpting mechanism. It's meant for people with stable weight and just need some stubborn area control. It's not meant to take away fat. So these patients, we encourage our patients to exercise, maintain a stable body weight before undergoing some of these procedures as well. So like you said, really it's a holistic, from inside out, exercise, time for self-care, mental health. And plastic surgery is just like one tool in the whole armamentarium of tools in this world.
Just for liposuction, for example, even after you remove the fat
can come back,
right?
If
you don't take care of yourself and eat healthily and do exercise and that kind of thing. So when you actually advise patients, it's really, like you said, more holistic. It's not just the procedure itself, but the other things you need to do after procedure to make sure that it stays.
The results stay as well.
Okay, so what is one myth that you wish, what is one myth about plastic surgery that you wish more people would need to let go of?
I think the misconceptions that the people who do plastic surgery are vain or are succumbing to societal pressure. Which might be unrealistic. And precisely that is not what we want. Plastic surgery isn't about that. It is for people to be empowered and for people to embrace their own beauty, not the beauty defined by the world.
And so like for, you've seen so many patients, I'm sure, like over the decades, right? When they actually walk into your office and tell you about what they desire, are those kind of doubts or concerns usually top of mind when they come in terms of like, I don't want my family or friends to know that I even went?
I think there are some who do, but I think increasingly, and I guess it's a self-selection, patients that come to me are more open about it already because they have taken that step to consider surgery. But it can be so life-changing, even something like bad ears, like prominent ears.
Bad ears?
Or for like guys who have gynecomastia and they are suffering from all the teasing all these years.
What was that second one that you said?
Man boobs.
Men boobs.
Okay. So, they end up being teased, young boys being teased from childhood perhaps till they're bigger. And, it's not that you're trying to change them into someone else, You just want to help them become what they are and not be subject to the teasing. So like, pinning back the ears, reducing the gynecomastia. These are plastic surgery, but it's not because they're vain. I think everyone has a right to live comfortably in society. So it's not succumbing to societal pressure. But I think there's nothing wrong with undergoing these procedures so that you can feel more confident. Like I said, it's for yourself, not for other people, because people will still say whatever they say. But a lot of times it kind of affects these patients more than you might realize.
Yeah, true. I have a few questions to ask, like men boobs, right? Are those usually genetics or inherited, or part of it is also how much they eat as well?
I think there are many causes about it. True gynecomastia can be due to, it can just happen, especially as part of adolescence, where you don't know the cause, it just happens. Well, sometimes it could be due to weight gain, but it can be due to drugs or other pathologies that we usually need to rule out first before we say that it's idiopathic, and it's just no particular cause. But it can happen and tends to happen in puberty.
Oh, really? I had no idea. Yeah, because we don't talk about it. Oh, okay. More common than we think.
It's more common than we think. And a lot of them end up trying to work out to camouflage it, but doesn't really help because the breast tissue is still there.
So in these cases, should someone come in earlier rather than later?
I guess there's not much difference. Like, it's never too late.
Yeah.
But, if they want it dealt with, then they can.
What is one advice you have for young and aspiring plastic surgeons?
Okay, so this is something I always used to tell, the young aspiring plastic surgeon wannabes or my juniors. And I think this is why I had 5 kids and took on that program director thing. It's to encourage them that, it may be a tough journey, but it's worth it at the end of the day. If you know what you're going for, and if you can make the relevant changes in your lifestyle, get the relevant support that you need, equip yourself, mentally prepare yourself for this route, then you will not regret it, because there are different seasons in life. I think some people hesitate to take a difficult route because of family or whatever. But what one mentor told me once really left a very deep impression of me, and that's there are different seasons in life. Some seasons you give more in this area, and some seasons you might throttle back in your career or your family. But getting that help, the support network that you need, and equipping yourself so that you can have both is so important. And the truth is, in line with seasons of life, children grow up. They start having their own lives. They earlier than you think, even in like secondary school, they start having their own programs. And if we live our lives and make our choices in terms of our, career paths and all that, based purely on them, when they grow up and leave the nest, then you are left with your choices. And you should not resent anyone for that. But, it's so important to know that just because it's difficult doesn't mean it cannot be done. And I felt that maybe God gave me 5 kids and a career just to show those after me that it can be done. And because that's the best way for me to encourage and perhaps for those ahead to smoothen the path for those after.
Yeah, I love that. To embody it yourself so that you can show others as a good example of what a life like that could look like. And actually, I think the key to this is to raise awareness for what it takes in different professions and within the industry as well, what the different specializations actually mean, and that sometimes, honestly, the hard path is the one where you learn the most.
Yes, indeed.
I've realized that in life.
Yes.
The hardest moments in my life actually shaped me to who I am today. So,
and that reminds us as moms, right? That sometimes we want to smoothen the path out for the kids so they don't fall and they have a good path. But sometimes it's through falling and getting up and falling and getting up that they learn the most and grow the most.
Always. Such big life lessons. So I have one final question. Is it easier to be a surgeon or to be a mom of 5?
I would say to be a surgeon. To be a surgeon, I guess I can plan, I can control, I can execute, and the outcome is more or less expected. I think with children, you can plan all you want, you can do all you want, but it's their lives and their journey to take. And the outcome is really not within our control. So to be able to let go and let them fly, I think that's the hardest part of being a mom.
Yeah, true. You're actually more like a facilitator.
Yeah.
You don't actually own,
We don't.
you know, and you don't control them either. Thank you so much, Michelle, for this very insightful conversation. I know we can dive into so many different topics because there's so many different procedures.
Yeah.
Hopefully today the audience gets a taste of a different side of plastic surgery. So thank you very much.
Thank you.
If you liked this episode, remember to like, comment, or subscribe, and check out the episode with Dr. Liu YY on the Real ER.